San Bernardino is 60 miles out of Los Angeles. It's considered the ghetto of Southern California because there's a lot of violence, a lot of families in poverty, a lot of homeless. Living in the borderline of San Bernardino, I see both ends. When you go to Loma, it's a lot of educated people, a lot of nice houses, a lot of families that have a mom and a dad and all that. And when you go over to the other side where it's San Bernardino, it's a lot of broken families, a lot of people struggling to make an income. So being in the middle, I get to see the bad side and the good side, and it makes me want the family, the good income, the beautiful home, and that's what my inspiration is. So I get to see what I don't want to be and what I want to be. My mom, when she got pregnant with me, it wasn't a good situation. So my grandma had this hatred towards me. It was very hard growing up because I started believing what my grandma had told me, that I was stupid and that I was never gonna do anything in life. It started to just overcome, I couldn't deal with all the anger I had inside towards my grandma. So my only coping skill was self-harm because I didn't know any other way of dealing with the stuff that was happening to me. After I got admitted into the behavioral medical center, that's when I knew what my calling was, because I knew that I had to help somebody. I met a nurse and she really showed me that even I was going through something at that moment, that there was so much things that my life could be made of, and that nurse kind of opened the doors for me for what I want to do, and I want to be a psychiatric nurse.
So it's a very unique setup here at Gateway College, where we have entry-level medical professionals like medical assistant. They're interacting then with the RNs, the residents, the attendings, as well as the medical students. So in that approach, then it's this vertical all the way from attending, resident, medical student, PA or NP student, physician assistant, nurse practitioner, nurse, LVN, MA, and MA students all interacting together. This is a time where it's not just a top-down approach to education, but it's also a bottom-up approach.
So the Gateway College students really teach me how to best serve the people of this community that this clinic serves. And they do that because they come from this community, and that's something that I can't learn from anybody else.
The residents are getting exposure, the attendings are getting exposure with the medical assistant students who are working in the clinics in order to provide that vertical integration. The horizontal integration is then the interprofessional work. So a clinical pharmacist, a dietitian, a behavioral health therapist are seeing and interacting with the patients as well as with the other learners.
The adult who comes to see you in internal medicine who's a domestic violence victim and has children at home, that places that child 6 times more likely to be a victim of child abuse.
So whether there are medical students, whether they are the MA students themselves, whether there are the attending physicians, that interprofessionalism is happening.
I'm graduating from the medical assisting program. It just feels really special to be the first class and inspire other kids and other adults. I love Gateway and I love everybody here. I'm a medical assistant now at SAC Health System, which stands for Social Action Community Healthcare. I love my job, and giving back to my community in healthcare is amazing because when you try to help a patient and you know what they're feeling, it's a different experience. That's why I am here, and that's why I pursue healthcare, because I want to help a little girl or somebody that doesn't feel loved, to let them know that you have a purpose in life. Don't let anybody stop you.